Hi, this is Heidi, episode 96, Life Coaching versus Therapy. Life isn't a spectator sport. Success comes to those who show up every day with a pocket full of courage, grit, and a little sparkle. I'm glad you're here. Hello, how are you, family and friends, listeners? I personally am so grateful it's summer. My children are done with school. Summer is my season. Okay, today I want to answer a question that I've gotten ever since I started my business and started telling people that I was going to be a life coach. At first, people would say, "You're going to be what?" And that makes total sense. I totally get it. 10 years ago, no one had heard of a life coach, or if they did, there was just little regard for it. I don't even think that 4 years ago I had heard of it. Luckily, over the last many years, there have been many more mainstream discussions about this, and we know about so many more life coaches. There's more awareness, focus, and acceptance that mental wellness should be a priority for everyone. So I find people are more open about discussing going to therapy or sharing how a coach has helped them, which decreases the inappropriate and harmful stigmas around any mental health diagnosis or support that we all seek and need. So there are many different types of coaches or mental health professionals, but in today's podcast, I thought I'd share some ways to differentiate between the work that therapists and coaches do, because it's very common for people to actually work with both, because each does something very different. One of the best ways for me to illustrate what a life coach does is to first tell you a story of my son Carter tearing his hamstring in soccer this spring. In the last games of the season, he tore his hamstring, but he kept on playing. He wanted to play in his senior game, but he really was injured. So then he had to stop playing altogether. He was out of the game. To determine the extent and get proper care, I called his pediatrician for an appointment. We saw the pediatrician, who he can help us with his general care, and he told us what he thought the injury was, and he referred us to the sports medicine surgeon. Okay, so we're going to a second person. We then went to the sports medicine specialist and surgeon who diagnosed it. Yes, it appeared to be just a hamstring tear, but that actually was pretty bad. Nothing worse, though, which might have required surgery or more invasive or serious treatment. And he referred Carter to get physical therapy for a few weeks, and the therapist could give him specific exercises and treatment to get Carter back in the game, to get him healed to play lacrosse with his brother, which he didn't ultimately do, but that was the goal. So we then went to the physical therapist who worked with him, gave him exercises to help him learn to strengthen muscles around the torn or injured muscles, to teach him how to warm up and cool down, and more. And the therapist helped him determine when he could push himself more, what to look for when running, all with the ultimate goal that Carter is back in the game, going back to the environment with a coach. Each of the people we saw were trained and specialized in a specific area and deal with people who present with different injuries. Neither was better or worse than the other, just different specialties. I like this example because the injury and being in and out of the game are exactly like what a therapist and a coach work with people on. Therapists help people who aren't playing well in life to heal, to learn tools so they can get back to a neutral playing level in life. A life coach, like a coach on a soccer team, works with people who don't have a specific injury or diagnosis that's preventing them from being in the game or showing up in life. And the coach teaches the players skills so they can improve, so they can reach goals, so they're better team players. My son, like other athletes and like us as humans, also worked with the physical therapist while he was also able to transition back to a team and have a coach. The therapist was teaching specific muscle-related exercises, and the coach was helping him develop different skills. Both were necessary, Both are trained in different tools. Both have different lenses through which they see the patient through. And both are needed at different times. Now, Carter wouldn't have healed correctly without the therapist helping him. In fact, he may get hurt in the future if he doesn't continue to do the exercises the therapist gave him. And to improve as a player, he has to work with a coach who's on the sidelines, who sees the bigger picture, who knows how the game is played and can give support. The coach takes healthy players and helps them improve. Now, many of my clients work with both me as a coach and with therapists if they're working on specific past trauma or past injury issues. This is one of the easiest ways to distinguish between the work of a coach or a therapist. Therapists often are helping clients address and process issues from their past. Coaches, just like a sports coach who helps players in the game, coaches help clients who are healthy enough to be showing up in life. Clients who are at a specific level of baseline functionality and who want to look forward. Clients who want to improve. Clients who need help overcoming obstacles and want help developing confidence or mindset or habit muscles to reach goals. A therapist can help a client uncover past issues that are promoting current emotional eating and gaining weight, and a weight loss coach can help a client love their body, teach them about nutrition, help them with the mindset, help them set boundaries around food and with people, and learn to process urges. So just an example. A longtime client of mine who also saw a therapist would often tell me, I get so much out of talking to you. With you, we're always talking about how I can approach what I'm going to do. You help me mentally prepare for the week. She didn't say it this way, but she meant you're helping me with my future. And I think that's a big thing to recognize. Another past client who also met with a therapist told me how much she loved how I phrased things to her, how the examples I used and how I taught her just made sense to her. So with a therapist, coach, or any health practitioner, finding someone who connects with you is so important. The common and really only knock that people throw at coaches is that life coaches do not need to be licensed to practice, and therapists need to be licensed in the states in which they practice, which is why I actually see a lot of therapists who now promote that they are coaches, and I think legally this opens their opportunities. And I'm sure they use different tools in each situation. Now, I've gotten a lot of training and certifications because I want to have the best tools in my toolbox. I want to always be sharpening my skills. But ironically, no one has ever asked me where I'm certified. As is the case with most life coaches, we attract people who truly believe we can help them. Where we are trained has little to do with the transformations we've created in our own lives by using our tools. Unlike therapists, usually a life coach presents themselves as the transformation of what is possible with the tools they teach. They're a model of what is possible. A lot of people come to me wanting help or to feel better, and I can tell I don't have the tools in my toolbox to help them. Often they aren't healthy enough to be in the game per se. Or mothers come to me wanting help for their teens. I'm very happy to refer them or help them find another source of support. Most of the coaches I know bend over backwards to support other coaches and therapists, and we really don't practice any sense of scarcity. I personally am a little skeptical of therapists and coaches and really any professional who is going to badmouth another professional. That shows a real lack of security on their part. Now, like this scenario with my son, I can't imagine the physical therapist bad-mouthing the surgeon who referred him, and I can't imagine a physical therapist looking down or feeling superior to a coach who is coaching the game. And if they did, it's a reflection and it's ignorance on their part, the one who's doing the criticizing. The world is big enough for everyone who wants to make a difference for someone else. And just like any profession, the quality of a therapist or coach varies widely. And probably the biggest factor in any mental health improvement is your belief that the person can help you, your willingness to compassionately look at your thoughts, at your humanness, to love it and move forward. Okay, one last example of the differences, and I've used this a lot when I know a client really needs help with a therapist before my tools will really be able to catch on and be accessible for her progress. Dr. Bruce Perry is a neuroscientist and psychologist, and he has a fantastic model of the brain. He calls it his upside down 4-layer cake. The lower brain is at the bottom lower level. And all of you, my listeners, know I talk a lot about the lower or primitive brain. Now, in his model, he shows that everything we process in the world is first processed through this lower brain. And then, if we aren't stuck in trauma loops, then we get to then process what we experience in life through the higher layers of the brain, with the top being the prefrontal cortex, that higher confident brain. Many therapists I know and highly regard, many therapists I know who I regard very highly help clients who are stuck processing life in the lower brain, who cannot get out of the stress, anxiety, and trauma loops. They need help unraveling issues so the higher brain can even come online. A life coach helps people who are able to move past the survival trauma triggers or mental looping in the lower brain, that lower brain of the cake. And a coach teaches tools to use the most powerful part of our body, our higher confident brain, so we can look forward, so we can change, so we can create a different and better future, to create new identities in terms of what we want to believe about ourselves, to allow the discomfort of change and growth to really reach the highest level of what is possible in our lives. This is what I do. I absolutely love the tools I use with my clients. I love seeing clients create new ways of thinking about themselves, about their lives. I see them release harmful stories. I see them take courageous action. I see them embracing discomfort and knowing it's an important step to reaching goals. I see clients apologize and forgive and make amends. I see them heal relationships and drop very heavy bags of worry and fear and stress. Now, I hope these explanations have been useful for anyone who wasn't really sure the difference between a coach and a therapist. I think everyone needs to be talking to someone. Life can be a challenge. Life can be hard. And for those of you who don't have a hard life, you should probably look to create discomfort because you have more potential for growth. And I can help you do that. A confident mother is the greatest gift to her family, not a perfect mother. Your family wants you to feel confident, anchored, and calm. And I can help you uncover this version of yourself. Have a great week.